The first case of the coronavirus variant fueling a devastating outbreak in India has now been detected in San Diego County. Good evening, I'm Lindsay Pena.
And I'm Steve Atkinson. The infected person traveled from India to San Diego and had to be treated in the hospital. Our ABC 10 News anchor Derek Stahl is going in depth on what we're learning about the variant some call the double mutant.
Record-breaking COVID cases in India have left hospitals overwhelmed and patients desperate for care. India recorded nearly half of all the infections worldwide last week, and experts think part of the reason is the B.1.617 variant. County health officials now say a woman in her 20s was hospitalized here in San Diego with that variant. She had traveled from India to San Diego in late March and wound up in the hospital in early April. She was not vaccinated, and she was released from the hospital after less than a week.
We've only detected a handful of cases in the state, one in San Diego and a few in the Bay Area.
On Tuesday, the Biden administration imposed a ban on travel from India by non-citizens. The 617 variant was first found in the state of Maharashtra, and it's become the dominant lineage there. It has several mutations, but it's nicknamed the double mutant because it has two important mutations on the part of the virus that attaches to cells.
We don't know what the combination of those two mean. At the minimum, it's going to mean that it's more transmissible.
UC San Francisco's Dr. Peter Chinhong says one of the mutations in the India variant is similar to one found in the South Africa and Brazil variants, a mutation that seems to make those more elusive. But a small study in India recently looked at blood samples in a petri dish from a few dozen people, and it found antibodies produced by the Novavax vaccine did neutralize the 617 variant. Dr. Chinhong says that bodes well for the vaccines available in the U.S.
If the Indian variant came in November or December of 2020 in California, it would be a different scenario than now because we have a lot of people protected both from natural immunity and from vaccine-induced immunity.
He says India is at much greater risk from the variant than we are because just 2.1% of India's population is vaccinated. Derek Stahl, ABC 10 News.
This afternoon, a county spokesperson told ABC 10 News they identified one person who was in close contact with the case here in San Diego. That person did not develop symptoms.